Hi, welcome to Tipsy Tooth Talk. I'm Dr. Carlin Palmer Blume.
And I'm Dr. Michelle Bishop, and I call it T cubed because I can't say it. Heck, I couldn't even remember it for a second. It's been a hot minute, y'all.
Sorry, guys. It's mostly my fault.
Well, mine too.
I moved. I got divorced and I moved and sold my house, and it's been
just
crazy.
rode down the street, but no more. Now we're like 20 minutes across town from each other, but it's fine.
It used to be easy to just pop down here.
Yes.
And but setting up a house and doing all the things, and then she's had some exciting stuff going on around here.
Yes.
So anyway, we have excuses, but we're back. And hopefully we'll get back to once a week.
Yes. All right. So dental side wise, we're going to talk about some things that I've taken a few classes on. They're really just conversation starters within the practice, like things to make you go, remember, what was that? Why did that just
make you go, That was Arsenio Hall, wasn't it?
Oh,
yeah.
It was.
Yeah.
And he'd do this. Would he do it with his finger or his pinky or this? No, this.
I remember.
Things that make you go, I don't know, that just came to me like out of the blue.
And there was even a whole little song, a backup singer.
Yeah.
Things that make you go.
Okay, well, we're dating ourselves. Let's move on. Okay. People are like, who's Arsenio Hall? Sorry, Arsenio Hall.
He had a talk show and everything.
Oh, he was funny.
Yeah.
Okay. And what are we drinking?
So we are drinking a drink called the Serendipity. My friend Darren sent to me, and it is a drink from the Ritz-Carlton in Paris.
Ooh.
It's called the Hemingway Bar because Hemingway himself used to frequent there.
Dang it, why didn't I know about that when I was in Paris over the summer?
I know, that would have been cool.
Okay.
I found out a little too late.
Yeah.
But so they have this now this isn't the official menu. This is printed off somebody's picture on the online. But anyway, the drink that we're making is this very top one right here.
Okay.
So it's called the Serendipity, as I said, and it was first created on New Year's Eve in 1994. So it doesn't go all the way back to Hemingway's time.
Hemingway wasn't sipping on this.
But the bartender had been there 25 years. I believe they said his last name was Fields. Fields either made it or he's the one who ordered it. Either way, the person who drank it, tasted this drink that was made for them, said, "This is serendipity." And followed it up and said that serendipity is when you find what you've always been looking for without knowing you were looking for it.
I like it.
And that was the description of this drink.
Okay.
So we're gonna make it.
Okay. Let's see if we didn't know we needed this.
I'm hoping.
I'm hoping we need it.
So we're having dinner here tonight. It'd be fun to drink more of these.
Yes.
So we're gonna put a few sprigs of mint in your glass. You can choose how much.
I like mint.
I do too, so I'm gonna grab another one for you.
You grab.
Oh, there we go. Oh, I'm gonna make a mess. Okay. And then after we do the mint, we're gonna do an ounce of this Calvados, and which is a brandy. And I was unfamiliar, but there were different brands of Calvados, so it's a type of brandy.
Oh, okay.
And Darren told me that they used to use it in cooking a lot at Serendipity, which was a restaurant here in San Antonio ages ago that was just wonderful. So we need an ounce in each one.
In each glass.
Mm-hmm.
Okay. I can do that. Go.
All right. And then,
That smells good.
it does, doesn't it?
Ooh, yeah.
And then we stir. So
Okay.
you can take your little straw
Okay.
and we can stir that in. It says not to beat up your mint, but to kind of press it.
Okay. So we're not trying to muddle it, though.
No.
We're just trying to gently make it make friends.
Mm-hmm.
Okay.
Okay, and then we each take 3 to 4 ice cubes. I'm gonna let you go first.
I'm just gonna dump.
Okay,
Oh,
there we go.
There you go.
Okay, and then we have, it said clear apple juice. So I found the clearest apple juice I could find. I thought clear meant like not color, but it really means not cloudy.
Oh, like not like
Yeah.
filtered, not
Yeah.
unfiltered apple
Yes.
juice. Okay. Okay.
I found, some fancy apple juice, the Martinelli's,
Okay. What do we need on
at
this?
good old H-E-B.
HEB, right there. Plug in.
This is 1 3/4 ounces.
Oh, okay. Cool. Cool. 1 3/4 for each.
Mm-hmm.
Oh, I'm spilling. Okay.
That's usually my job.
I know. Okay. One and 3/4.
Okay. And then we can stir a little bit more. Work that in.
Okay. Everybody be friends.
And then we top it off with brewed champagne.
Well, that's always good. I mean, bubbles make everything better.
Mint and bubbles. I think we should be good with this.
Yeah. I don't feel like I'm gonna have to make the face.
And they had it garnished with this beautiful orchid, and I just didn't even think to buy some flowers to put on it. So we have mint.
That's fine.
And it's pretty enough.
That's great. The glasses have etched little flowers. We'll just call it a day.
We have fancy glasses.
Okay. So,
All right.
okay.
Cheers to
beautiful smiles.
Let's see. I mean, it's fine. It tastes like apple juice.
Yeah.
Maybe cut the apple juice and increase the brandy.
I don't know. I can feel a little bit of the burn of the brandy.
Interesting. All right. We'll see if maybe
I
after
like
it
it,
sits, if the mint will come through
Infuse
a little
more.
bit. Yeah.
I might push on mine just a tad.
Yeah.
Okay,
I
well,
want to taste more mint. That's what I think I want from it.
Yeah, that's what I was expecting too. A little
Yeah.
more mint. I will say it's definitely not face worthy, like bad face worthy. But the apple juice.
Like the Grinch. That was the
Yeah,
Grinch.
the
right?
Grinch was, yeah. Go back and watch that episode. You'll see my fake face. Like, it's not bad.
And I was like, yeah, it was.
Oh wait, I sucked at the mint. It's the only problem with things that have mint in it. I always end up sucking them up in the straw. It drives me crazy.
Or blackberries.
Yes.
Oh.
Okay, I like it. I'll drink it.
Okay.
I'll drink it. Okay, so this whole conversation is really just about wellness and how thankfully there is this new shift towards what we have always said, but I believe the medical side didn't quite get on board with. But hey, guess what? Your mouth is connected to the rest of your body. What? Shocking. Like, it's not its own separate thing. Like, what's in your mouth actually affects everywhere else.
Which we're going to email this Express News and Mr. Lipman about that.
Yes. Yes, bless his heart. So I've taken a few courses on basically dental wellness and incorporating some things into my office. And if you, we'll get to this, but this is a fantastic read. Like, if you have a family history of heart problems, high cholesterol, diabetes, you need to read this book. Like, it reads like a horror story if you're into that, or it's really great information. However you want to look at it, I highly recommend it. And there are some things that we'll talk about in that. It's called Beat the Heart Attack Gene. It's crazy cool. So one of the first things, so again, all conversation things, people come into me and they say, gosh, my neck is killing me, and I don't know what's going on, and it hurts in here, and we're talking about joint issues, stuff. So I'm going to do a little test on Carolyn that she has no idea about. Oh, almost knocked over my drink. That would have been catastrophe. So I'm going to let you pick up your own popsicle stick.
Okay.
And what we're going to do is we're going to do three things twice. So I want you to tip your head all the way back, and I want you to look at the ceiling and just find a spot and be like, okay, that's where I looked. Okay?
Mm-hmm.
And then go ahead and come back to regular, and then look left and look right. Of course, I did it backwards. And just find a spot, that you recognize, right? And then we're going to tip our head to the right and to the left. Okay? And now we're going to put this between our teeth. And we're going to repeat the same thing. Go back and come forward and take it out. Could you go back further with it in your mouth?
I didn't notice a difference.
Okay. And now put it in between your teeth, and I want you to go right and left and see if you can go further.
I mean, maybe, but I didn't have the instructions to go as far
Yeah.
as I could in the first place.
Oh, well, okay.
I just looked.
Oh, okay.
No, it's about the same.
Okay, good. And now do it again. Not that. Put it between your, and you're going to do the side to side. No? Okay. All right, she's not a good example. For me, if I put this between my teeth and I go, so if I go this way and I do this and this, it makes no difference. But if I go this way and this way, I can go further with this between my teeth. So going back and looking down tells you whether or not your C1 vertebrae is has a problem with it. Left, I keep doing it and I keep going to the right, but right to left, if you can move further with the popsicle stick between your, is C2. And then C3 to 5 is the side to side. So what does the popsicle stick tell us? If you're having problems with muscles in your neck and the popsicle stick makes a difference, you have a bite issue that's impinging on your spine. If you can move all the same and you're still having neck issues and the popsicle stick doesn't make a difference, then that's truly, just muscular, and you should probably see a chiropractor, things like that. But when people come in for like, my joint's killing me, blah, blah, this is a great easy test that we can do in the office now and be like, okay, is it your bite? Or do you maybe need to go see a chiropractor or talk to your medical doctor again? So, cost me a popsicle stick.
Yeah.
Not charging anybody for that.
That's
So,
awesome.
Little that. So,
Sorry, I wasn't a good test subject.
That's
I guess
okay.
my
I
bite's
guess you're
good.
normal. Yeah, I guess you're good. Okay, so then earlier, I made us spit into a cup.
Yeah, I got here and I was about to eat something. She's like, no, don't do that. You have to spit first.
Okay.
Sweet.
So the other thing is we can actually test the pH of your saliva, which tells us a couple things. Sometimes I have patients that we're getting everything cleaned up, we're taking care of all the cavities, and they're still like, they come back in 6 months later and they're still chock full. So I'm like, is it really your diet? And they're telling me their diet is good and that, they're doing all the things that we've asked them to. So now we can go back and test and see, like maybe it's the pH of your saliva. Maybe we need to be talking about changing what you're eating to neutralize your saliva. So this is super simple, and we're gotta tear off that because that oxidizes quickly. And all you need to do is tear off a piece about that big. I'll let you tear your.
Oh gosh.
It's not that hard.
Well, apparently.
And all you have to
I'm in
do.
remedial tearing.
So in the office, I would just have them put this in, and we're gonna do this again under the tongue, but we just had a drink, right? So it's gonna be different. So this is gonna show you how things affect things. So we're just gonna quickly dip it in. As quickly as you dip it in, take it out. Okay? So now we're gonna look, and there's a color code here. So I'm pretty neutral. You're pretty neutral as well.
Yeah.
Well done.
Hey, Amy,
Um,
can I just dump this in my cup now?
We're gonna use the cup again, but
Oh, yeah.
you can dump it in there.
Okay.
And then, so pH of saliva, that'll tell me whether or not, something's going on with how your saliva is balanced, right? Maybe then we need to have a conversation about diet again. One of the other things is the nitric oxide level in your mouth, because I'll give you that. That's the tip. This tells us your inflammation. Are you more susceptible to having inflammation in your mouth? Which then, oh my gosh, I'm gonna knock this bad boy over. Are you more susceptible to gum disease? Inflamed tissue, things like that. So we're just gonna quickly dip it in there. That sit for just a second until we see the color. Swish, 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 swish. That's good.
Oh, it was upside
You're there's only one side. Okay. So then we have this here. I'm pretty optimal. You can see the color change. Ooh, you're a little on the low. Did you drink coffee or anything on the way over?
No, I had water on the way over.
A little on the lower side. So nitric oxide is a great indication of, if you don't have enough of it, you tend to have more inflammation. We see that in people that have gum disease. Then we want to have that conversation with them, like, hey, we're seeing the nitric oxide is a little low. Let's talk about, your gum disease, how we can get that under
I
control.
just had an exam. I don't
Yeah,
have
she
gum
doesn't have gum
disease.
disease, but it's just one of those things when we have people that have that, then we can begin the conversation. These are all just conversation starters and things that we can then write out, and you could take to your medical doctor and be like, hey, I was at my dentist and they said X, can we have this conversation? We're just trying to encourage you to have a conversation with your medical doctor, that the things we're seeing in your mouth may be affecting the rest of your health.
So
Still trying to get it?
I just thought maybe I didn't expose it long enough. So would nitric oxide be something you could get different in your diet?
It is. There are, let me see, I looked it up real quick. There's lots of foods that increase nitric oxide. Dark chocolate, actually. There you
And
go.
see, I haven't been having that lately
Oh, well, there you
because
go.
I've been trying to get back off sugar.
Things like watermelon,
Okay.
turkey, chicken, lentils, nuts, pumpkin seeds, walnuts, all things like that.
Gotcha.
Okay? So now that we've had this drink, let's check our pH again. Because I feel certain that, what do we do with that? Oh, I feel certain that apple juice should lower our pH a little.
And champagne.
Mm-hmm. Okay, all you have to do is put it under your tongue for like 2 seconds. Mine got stuck. Well, I'm still good too. Okay.
Well,
But the flip side is there are people that we have tested that have been in this light green orange range, and the enamel in our body, or the enamel in our teeth rather, begins to break down between 5.8 and 6. So if we're seeing people in this light green, we're already at 5. So it's just, again, conversation starters. Like, did you just chug a big red on the way over, or what's going on? So things to talk about. And then one of the other things is we are getting a microscope in the office, and we will take saliva samples, pretty easy. You tap it on a slide and put it under the microscope, and it comes up on a screen, and you can see all the different bacteria that's in your mouth. And if there's bacteria that you're more prone to gum disease, again, we're having that conversation. But there's also things that, for instance, I'll give you an example. The woman who taught the class was on her mother like all the time because she kept coming in and mom had bleeding gums. And she was like, Mom, why can't you brush? Good grief, like I'm a dentist. And she was like, I am brushing. She was like, no, you're not. Your gums would not be bleeding like this. And Mom was like, I am. She finally got a microscope. She took a sample of her mom's saliva, put it underneath the microscope, and she found out she had trichomonas from either kissing her dog, or she picked it up off like a dirty spoon somewhere. She put her mom on an antifungal, boom, bleeding gums gone. But instead of telling patients over and over again, you're just not doing what I'm saying, and them getting frustrated with us saying, yes, I am, right? How many people might have some bacteria that we could treat and solve that issue?
oh, cool.
Kind of cool. And then lastly, again, going back to the beat the heart attack gene, they talk over and over and over again how inflammation, they even have the health threat in your mouth, that they find that the majority of people that have heart, I used a bad lotto ticket, I didn't win, that was my bookmark. It says 75% of Americans have some degree of gum disease. It's the most chronic infection. It's highly inflammatory. If you're having inflammation in your mouth, it means you're having inflammation probably elsewhere in your body. And if your arteries are inflamed, you're more prone to high cholesterol, high blood pressure, throwing plaque, having a stroke, having a heart attack. I mean, they devote several chapters in here about gum disease and the role it plays in heart attacks and strokes. So again, just conversation starters. Hey, Mrs. Jones, you just had a heart attack. I see you have, gum disease. We're treating that. Let's have this conversation, let me write some things down, take this to your medical doctor. hopefully your medical doctor is open to having the discussion. But it just goes back to, hey, the mouth is connected to the rest of the body. Shocking, I know. But the more that we can be a partner in your health with your medical provider, the better it is for you.
Amen.
Yes. And then there's one last component of it that we'll probably have a whole separate topic on, and maybe we can get a friend of ours in that does this, but tongue ties, and airway,
Yeah.
and how it contributes to sleep apnea, and sleep apnea contributes to inflammation. There's just, praise God, finally there's so much research coming out how this is all interrelated. So I encourage you that if you're struggling with things like diabetes, blood pressure, you've had some heart issues, you've had, maybe many strokes or something, and your doctor's still saying, I don't know why we can't get this inflammation under control, please go see your dentist. I would bet you have some form of gum disease going on. And the flip side is, while you're at your dentist, if you don't have things going on and you have gum disease, have that conversation with your doctor. Hey, I have gum disease and I know my numbers look good. And if you read this book, some of the things that the traditional tests don't really show your true risk for heart attack and stroke. So, interesting stuff. I'm sure we'll talk some more about it.
On that note, this isn't a huge topic for kids. However, I do see kids with heart conditions, and it definitely shows up in their mouth. The thing about children is, when we see a rampant case of gingivitis in a child, and there's not a lot of plaque, we almost know there's a health condition, because we don't see a lot of gum disease in the pediatric population. So, while I think my patients would love, spitting in a cup, not going to introduce that at my office at this time.
And again, you don't have to. You can just put it under your tongue.
Yeah.
I just did it because I knew we were going to be drinking something semi-acidic, so I was trying to
But in my population, I almost know when we have a bad case of gingivitis that there's a medical condition.
Good to know. So anyway, conversation starters, just looking at your overall health and trying to be a partner for you in your overall health while taking care of your dental health. And I think that's an exciting way that dentistry is going. So, cool. Well, we're back. I mean, it took us a minute. I may have lost some hair along the way.
And I gained some.
That's how long it's been.
And shifted colors a little.
Yeah. It's all good.
Well, thanks, y'all. Thanks for tuning in.
Yes.
Hope to see you back here soon.
Try serendipity?
Serendipity. Maybe you can do a better job than I did. Something's not right here.
We're gonna reformulate and try again.
Cheers to beautiful smiles.